If I had any knee problems or back problems, this is the movement I would do on a daily basis. First, I would put my hands on my hips. So right on my pelvis, that would tell me where my natural belt line is. This belt line should be stable, strong and stable. So we're going to hold this stable and not let it move when we activate the hip mobility. Oftentimes when there's back issues and knee issues, it's because the joint in between is stuck. And we see this a lot because people are sitting more and more, and as a result of that, their hips are getting stuck. So this is a very simple movement that you can do, knowing that your hips are a ball socket joint. I'm going to take my foot forward a couple of inches because I want to move it in as wide range of motion as I can get. So if I have it right next to me, I can only move it out, but I actually want to move it internally and externally at the same time. So I'm just going to move that forward. And in fact, you can take it off if you have good balance. Go ahead and take it off. And so I'll just even move it out in different ways. But notice I'm not dropping my hips to do that. I'm stabilizing at my core. So my glute muscles are on, my quads are on. Nothing's overly working though, especially not my knee joints and especially not my back, because I've activated the correct muscles that should be holding the body upright. Now, if we go to the other side, I'll show you from this direction what it would look like. Hips are stable, right? So our hips are not doing any kind of hula hooping. They're stable because our abdominal chain and our butt muscles have helped stabilize what we call our powerhouse. And now I'm going to go ahead and take my foot, and it'll look like my foot's moving, but where I'm moving from is my hip, the hip ball socket. So it doesn't look like much is happening, but the movement that I'm regaining by creating this rotation in the hip ball socket is what I'm looking for, okay? So that's a really simple warm-up exercise you can do before we do this next movement called the stork walk. And that is going to come from that hip ball socket while we stabilize at the core. So we'll keep this static first, which means what I'm going to do is not move in a pattern. I'm not going to move forward or back. So I'm going to open up from the side. There's my internal hip rotation, the legs externally opening. And then I'm going to come across and bring it around. So I'm just going to do little movements in this way, and then I can reverse it going the opposite direction. So I've done a couple of those. I feel like, okay, I've got that. I'm still in alignment. I'm still activated with the correct muscles that need to be activated. And I can start to feel this hip getting a little looser, especially if I've been sitting. So this is a perfect sit break. And now we can do this as an actual walk. So we call this our stork walk. One of the things you want to look for in the stork walk is that you're not hiking the hip to get that up. We want, again, this area stable. And we want the movement to come from that hip ball socket joint. Again, that is one of the biggest reasons I see for people who have chronic knee and back issues, because those knees and backs have been doing the job of those hips. So try this out. See if the stork walk is the move for you. Hope that helps.